All right, guys, so I think there's around 10 people on Zoom, so thank you all for joining. There's about 3 people in person here, so but that's okay. We will embrace technology today. So it gives me great pleasure to introduce Associate Professor Erin Hartnett. Erin is a pediatric nurse practitioner and a fellow of the New York Academy of Medicine. Her main role is the program director for the New York University College of Nursing Oral Health programs, namely the Oral Health Nursing Education and Practice and the Teaching Oral Systemic Health. So Erin has developed a national interprofessional oral health nursing curriculum and has coordinated many oral health interprofessional experiences with NYU nursing, medical, and dental schools. She has published a number of articles on interprofessional oral health and has received numerous awards, including the 2012 New York Times Nurse Innovator Award, the 2019 Edge Runner Award from the American Academy of Nursing, and just last week, the 2020, how do you pronounce it? Is it Guys Award for Innovation from the American Dental Education Association Foundation. So we're really honored to have Erin here, and she's going to talk to us about the role of nursing across the lifespan in terms of oral health. So welcome, Erin.
Thank you, Josh. Thank you so much for inviting me. I'm very honored to be here. So I'd like to just talk with you about the different things we've been doing in our nursing curriculum, both locally and nationally, and hopefully it'll give you some ideas. Okay. Okay. So can you just check if the people on the screen can see the next slide?
Yeah.
Sometimes.
Can you guys see the next slide?
Are you able to see me and the slide? Or?
Yes, no problem. Yes, you're in the little window and we can see the slides. Thanks, Erin.
Oh, thank you. Okay.
Oh, no, we can't.
Oh.
You can't.
Where are you? Where?
I can see it at Campbelltown.
Sorry,
Okay.
who can't see the slide? Sorry? Campbelltown?
No, all good now, thanks.
All right,
Okay.
thank you.
Thank you. Okay, so the objectives today will be just to define the need for oral health across the lifespan, discuss the importance of oral health to overall health, and demonstrate some strategies for implementing oral health into nursing. So my program is called OHNEP, and that's for Oral Health Nursing Education and Practice. Our goals are to advance a national and now international oral health agenda for the nursing profession. And we want to build interprofessional oral health workforce capacity. The way we're doing that is integrating oral health into our undergraduate and graduate nursing curriculum. We have to first do that through faculty development, through curriculum integration, and then the establishment of best practices in people who are already in the clinical settings. I'm not sure if this is going to play out. Can you see this video?
You can
I'll try it. Okay. So it all started in 2000 with the Surgeon General's report. So the Surgeon General.
Oral health is a critical part to overall health and well-being, and yet we have not valued or realized the importance of oral health. So we've not built it into our systems of care. We've not rewarded those who provide it. So attitudes toward it have been barriers to access to oral health care. Part of that is just not realizing the importance of it. Part of it is the difficulty of accessing the system. And I think nursing is key to that. I think nursing ought to be incorporated in this major move to improve not only access to oral health services, but also the quality of care. The major trend that I think is important for nursing education is incorporating oral health care as a key part of overall health and well-being.
For the longest time, I've always had low self-esteem, and a part of it was because of my teeth, because people are very judgmental.
That's okay. Okay, so that was our Surgeon General showing his support of nursing. He did a report in 2000 declaring that early childhood caries was a silent epidemic, the most common chronic disease of childhood, 5 times more common than asthma. And he called on all the primary care providers to start including oral health into their care. And he is a big, big advocate of nurses in oral health. So even after his report, things didn't take off right away until the death of this young boy, Diamante Driver. Diamante had a toothache. He lived in Baltimore in a very poor area, and he had Medicaid. His mom could not find a dentist who would accept Medicaid for his toothache. The toothache developed into an abscess, the abscess into a brain abscess, and Diamante Driver died of a toothache, something totally preventable. And we always think, what if he had had a primary care provider who had actually looked in his mouth and taught him oral hygiene and connected him with dental care before it got to that point. So ever since his death, things have taken off a lot more. It drew attention to the need in our country for people who don't have access to health care and to oral care. And a lot of things began to change, but it took a while. Even though the Surgeon General's report was 2000, a lot of things really changed in the past decade. The biggest was we got the Affordable Care Act, where all children under 18 now have dental coverage. We have guidelines for oral health in pregnant women and some guidelines for the elderly. The biggest thing was our interprofessional education competencies, which were developed in 2011 and updated in 2016. This is, has been developed by 6 different health professional education organizations: nursing, medicine, dentistry, osteopathy, physical therapy, and pharmacy. And they came together to develop competencies for all health professional students that are essential for them to learn. And now it is a requirement that all health professional students have to meet the interprofessional competencies, and all schools need to show that they have interprofessional education for their students in order to be accredited. So this has really helped our role in advocating for oral health, because we believe that oral health is the perfect exemplar for interprofessional education. So a lot of people have been eager to embrace it. So we feel nurses, at least in the US, we are the largest health profession. We have over 4 million nurses. We have over 270,000 nurse practitioners. We have over 12,000 nurse midwives. Every year, the Gallup poll does a survey on the most trusted profession, and nursing always comes out first. And nurses are everywhere: hospitals, ambulatory care, schools, camps, workplace, retail, and in home care. They're on the front line. So they are really the people who can actually screen for oral health problems and educate and refer. One of the problems with our nurses is too many of them are in the hospital and not enough are out in the community. So we're really focusing now in our education on getting more and more nurses into the community, in primary care, in case managing, coordinating, and identifying healthcare gaps and closing the gaps through management and coordination of patient care out in the community, not waiting until patients get admitted in the hospital. So this is our oral health care model, and we have adapted it based on the WHO interprofessional care model. We believe we have very serious oral health needs. Our healthcare for oral health is very fragmented, but we feel we can build the primary care oral health workforce through educating our students in oral systemic education and in collaborative practice, that by learning both oral health and how to work together, they can increase the access for patients so that people will have more access to oral health, reduce oral health disparities, and improve oral health outcomes for the population. And we use the oral health delivery framework, which is a very simple framework that was developed as one of the tools for our National Interprofessional Initiative on Oral Health. And this is for primary care providers. 5 simple steps. Just ask people about their oral health. Are they having any current problems? If they had any recent dental work? Do they have a dentist? And what kind of medications are they on? And then to take the time to actually look in their mouth and look at their lips and gums and teeth and tongue and notice if there aren't any problems. We're not asking them to take care of the problems in terms of drilling and filling or extractions, but to educate people on prevention, on hygiene, and know what's normal, what's abnormal, and when to refer. So decide on the most appropriate response, and then either offer prevention or referral for treatment, and then document. So it's all a very easy framework for primary care to follow. So what we did at NYU, the first thing we did was develop a nursing faculty practice. And this is all nurse practitioners, advanced practice nurses, family nurse practitioners, and geriatric nurse practitioners. And we opened a primary care clinic in the dental school. So it was right there across from the dental admitting, so that all of the patients who were coming in for dental care to the dental clinic had access to primary care service as well. And then all of the patients who were coming in for primary care would have access for the dental care. So that this worked very, very well for a number of years. And then we started integrating oral health into the curriculum through different clinical rotations, collaborative courses, simulations, and some service learning. So we didn't want the nursing faculty to feel like they had to start a whole new course or students had to take a whole new course. We believe that faculty can just weave oral health into whatever they're teaching, that it's a normal part of their body, it's a normal process in the disease process, and it's something that they can easily just weave into whatever they're teaching. So we developed these toolkits for the undergraduate faculty, and these are online on our OHNEP website. They're free, open access. Anyone can go and pick and choose whatever they like. And they're based on there's a separate one for each course, from micro to research, to pharm, to fundamentals, to all the different nursing courses, adult, children, women's health, community, psych, and then leadership and professional nursing. And we just chose different topics from each of these courses and developed things that faculty can easily use. There are articles for students to read, there are activities for them to do, and then there are suggestions for interprofessional activities by looking at your campus and see what kind of professionals can you collaborate with. Do you have social work or pharmacy or respiratory therapy or speech therapy or medical or dental, whatever it is, and develop an interprofessional activity for the students to work on, either virtually or in clinic or in the classroom together. And then we developed a different toolkit for our graduate programs. So these are for all our different nurse practitioner programs: family, adult geri, psych, midwifery, acute, adult geri acute, and women's health. So these again are the same idea. They're open access, anybody can go on. Even if you're teaching in an undergrad program, you can still use things from the graduate program, but they're based on the 3 different classes in the graduate program. One is advanced health assessment, the other is a health promotion, and the other is primary care. So there's 3 different ones for each, but certainly they can be used interchangeably if it's something that somebody wants to teach in an undergraduate, they can use it, but they're just based on what's being taught in the graduate program. So what we had to do first was educate our faculty, because we can't expect the faculty to teach something that they don't know or haven't been taught. So we started having faculty development workshops either each semester or each year, depending on what the need was. And it turned out to be a really nice event that faculty from medical, dental, and nursing would all come. Certainly not all, but the select people who were interested and who were invited. And we'd have a lot of exchange, a lot of fun learning. And what we really developed was just a lot of interprofessional relationships between the faculties, because we were so used to always being in our own silo that we really didn't know what each other were doing. So this was so nice to just get people together. And once we did a few on oral health and people were comfortable, we started doing more workshops on interprofessional education and on using team steps, a way to communicate. So I think in there you can see we have the oral health, we have mannequins teaching them oral health, and then we had standardized patients that came in so people could practice. And then the activities on the bottom are some of the team steps ones, where you have teams building a tower or making chains. And it was just to get people involved in teamwork and learning how to communicate and collaborate and just get to know each other a little bit, so it was easier to work together. But then we thought we can't just concentrate on our students, because there are lots of nurses out there practicing that we don't want to wait till our students get out there and take years. So we started going to the different conferences, our pediatric nurse practitioner conference, our midwifery conference, and we go there every year and do a workshop. We either, for the pediatrics, of course, we can't bring children for exams, so we bring our mannequin head, but for the midwives, we have standardized patients so they can practice. And we always tell our midwives, we want you to be as comfortable in the mouth as you are in the vagina. We really think that they can do it. And then another group that we work with is our nurse family partnership. And these are nurses who are out in the community, and they're assigned to first-time at-risk moms who are pregnant. And they follow the mom through the pregnancy and then until the baby is 2. So we did workshops with them, and we did a pilot study with them that I'll tell you about too. So we start with our pregnancy, right? So we want to be sure that nurses who are dealing with patients who are pregnant understand about oral health, and that they should know that there is an association between periodontal infection and negative pregnancy outcomes, that when moms have untreated caries, that the children often have untreated caries. But in one study, 76% of pregnant women who were surveyed said they did have an oral health problem, but only half of them actually went to a dentist. And a lot of women are not going to a dentist, either because dentists don't want to see them, or the pregnancy providers are not telling them the importance of it. So we want to be sure that nurses, midwives, OBGYNs are making sure that they do tell their pregnant women to see a dentist. Because we know that periodontal treatment is safe for pregnant women, and it'll avoid any adverse outcomes for the mom, and there's no negative outcomes found in the babies. But we did find in one study that 44% of pregnant women said that their pregnancy provider, whether it was a midwife or a physician, never even told them to go to the dentist or to get their teeth cleaned or to have their mouth checked or looked in their mouth. So this is something that we're working on changing. So what we've been doing is we have this national consensus statement for oral health in pregnancy. And this is a great resource, and it's online, anyone can use it. And it has 3 different parts. One is for the pregnancy provider, one is for the dental provider, and one is for the patient. And the patient is actually a tear out sheet that you can give them. And the important thing is first for the nursing or midwifery to be screening patients, not only for any sort of infection or poor hygiene, but also for any oropharyngeal cancer. And to reassure patients while they're pregnant that it is safe. Even dental x-rays, local anesthetics, those are all safe during pregnancy as long as they're shielded. And even if they use lidocaine with or without epinephrine, there's no problem. Nurses are seeing patients in prenatal clinics. They see them in breastfeeding classes. So this is a great place to integrate oral health topics, teaching moms about nutrition, smoking cessation, about how to clean their babies' mouths when they're born, especially when they're teaching breastfeeding classes. And it's a good time to develop a community partnership with dental colleagues and find out what dentists will see pregnant women. And if they are not interested, maybe just having a little education, a little get-together where you can talk with them about the importance to you and your patients about being seen, and just educate them on how you do want them, your patients, to be seen, and find dentists who will see them. But I think it's most important that nurses reassure moms that it is a good time. And I know in the US, often pregnant women, they only have coverage. If they're on Medicaid, they may only have coverage while they're pregnant. And so we want to be sure for our patients to get them in while they're pregnant, because after 6 weeks, they may not have that dental coverage anymore. So this is the group I told you about, the Nurse-Family Partnership. So we did a pilot study with them. And all we did was an education session for these nurse home visitors. And we did a survey before and after on the nurses, as far as what is their oral health knowledge and what are they teaching the families or the moms. And then we had the nurses give a survey to the moms on their education. So after we did this, and we did a 30 and 90-day follow-up, we found that the nurse home visitor was really increasing the education they were giving the moms from 33 to 85%. The moms said they received oral health information, and from 33 to 85%, they said that the nurse talked to them about how to prevent cavities. But what is really impressive is that the moms were actually cleaning the children's mouth. It went from 50% up to 82% after 90 days. So at 2 years, the children graduate from the program, and we had someone examine their mouths, and we found that they had no white or brown spots on their teeth after this little program of just teaching moms how to clean their teeth. So we feel like it was a very simple and effective way to get at a very high-risk population. So we're trying now to get this into the National Nurse-Family Partnership, because right now we only did it with a local group in Florida.
Sorry, those guys on Zoom, do you mind muting yourself? Someone's just joined, we can hear you. Thank you.
So the other things we've done in terms of pregnancy and childhood, we have a webinar that we did, and we combined nurse practitioners and midwives and women's health and our nurse faculty organization, and did a webinar for all of them so that we could educate the members of these different associations online about oral health in pregnancy and early childhood. And then we have 2 articles that we've written. One is about oral health in pregnancy, and the other we just published, I think it was in the summer or the spring. And we surveyed all of the midwifery programs, and out of 39 midwifery programs, we were really happy to see that 33 of them are integrating oral health into their curriculum now. So our work hasn't been in vain with going to the midwifery conferences and all. So now we get to children and adolescents. So early childhood carries, as I mentioned before, a major health problem, most common chronic disease of childhood, 5 times more common than asthma. We have 16 million children with untreated decay. The early childhood caries are really found mainly in the children of lower socioeconomic status who either don't have access to care or insurance, and children are losing like 34 million hours of school just because of oral health problems. So what we want our nurses to do, nurses see these children. A lot of children may not be going for dental care, but they are coming in for their primary care, they're coming in for their immunizations, they may see them in schools, to know how to do a caries risk assessment, to do an oral exam as part of their head, eyes, ears, nose, and oral cavity and throat. And fluoride varnish is something that nurses, it's very easy for them to apply, and it's something that can be done. We have a program now that we're working on doing it in the schools, and we do fluoride varnish and silver diamine fluoride, and also just educating parents on the importance of oral hygiene, because how many parents say, oh, they're just baby teeth, they'll fall out, you know, why would we want to take care of them? To make sure they know that they're so important for speech, for nutrition, for socialization. And then the importance of finding people in the community who will see these children and be sure. I know it's recommended for us, for a child to have a dental home by age 1. And it's often hard to find somebody who wants to see a 1-year-old, but if at least they're getting this care and primary care, by the time they get to a dentist, you know, maybe 1 or 2 or 3, hopefully their teeth will be healthy. But it's really important that I think they see a primary care provider 13 times before age 3. So there's no reason for oral health to be missed. So we have our students go out to the Head Start with the dental students, and they learn to do the knee-to-knee exam, where this is comfortable for the child because the child can sit in the parent lap, and then their head rests in the provider's lap, so you can get a really good view of their teeth for doing an oral exam and doing fluoride varnish. And our students learn to do this with the dental students, and then the dental students learn how to kind of manage a preschooler's behavior and learn more about growth and development from our nursing students. And then we have interprofessional clerkship. This is at our Bellevue City Hospital. And we combine our medical, our nursing, and our dental student together on a team with a pediatric dental resident. And they see the patients who are coming in for dental care. And this is a very high-risk population in Bellevue, very much lower socioeconomic. Most of them are on Medicaid. And the children come, and the way we have it divided is each student has to work as part of a team. So if the nurse practitioner reviews the chart and takes the history on the patients, they're all working together. She lets the other 2 students know what's going on. The dental student will do the exam and fluoride varnish. Then they huddle with the resident and decide a plan. And then the other student, say it's the medical student, will give the patient education, the prevention, the anticipatory guidance, any handouts, referrals. And then they switch it up for the next patient that comes in. The medical student can do the chart, and the nurse practitioner the exam, and the dental student the education and prevention. So we have them working together in the dental. And then we also have a group that goes into the pediatric medical to do like an oral health integration there. So before and after this interprofessional experience, we give the students the ICAS survey. And the ICAS is the Interprofessional Collaborative Competency Attainment Survey. And this is a survey that's online. It's easily accessible. We send it to all the students right before the experience, and it measures their self-reported interprofessional competencies in terms of communication, collaboration, and team functioning. So we found in this interprofessional pediatric dental experience, that the students across all 3 schools were able to show a statistically significant change from before till after the experience in their interprofessional competencies. Okay. And we have a program that I used to work in pediatric oncology, and we started a program where I educated all of the pediatric oncology providers on doing oral exam and fluoride varnish. So all of the children will get fluoride varnish every 3 months. And then we have a dental resident who's there 2 days a week to take care of the children. Any needs, they'll be able to be seen right away in the dental clinic. And then the dental resident is also responsible for any of the patients that are inpatient and screening them before treatment. So when it comes to adolescents, our biggest concern is HPV, since it's so common, and adolescents are most at risk, age 15 to 24, to get HPV. But now HPV is being found to be the leading cause of oropharyngeal cancer. So we want to be sure that our adolescents are getting the anti-cancer vaccine or the HPV vaccine, which should be given when they are young. But a lot of parents are resistant, so it's really educating them. And then another very big problem that we're having is vaping. And now it's even gotten more serious with quite a few deaths from vaping too. So we're really on a campaign now to decrease teen vaping. And I think that's a lot nurses can do to educate their students and patients in schools and clinics on this as well. So we want to be sure that nurses are looking in their mouths and educating parents and patients about HPV, about smoking, vaping, and to be sure they are getting the vaccine. And even now it is okayed for up to age 45, so there may also be parents who could get the vaccine as well. And then we made these HPV fact sheets that we have in the different primary care offices. And we've written some articles. One is on that pediatric clerkship and the impact of interprofessional education. One is on the oncology center educational program. And then the other, we just published that in the dental clinics of North America on early childhood caries. And for adults, we have a lot of decay in our adults who are not getting treated, 27%. Half the people over 30 have gum disease. Adults are losing a lot of hours of work. And then we have a lot of people with diabetes. And diabetes, a lot of the people with diabetes don't understand or haven't been told about their risk for oral complications. So there are many chronic diseases that are a major component of adult healthcare, and we believe nurses working in this population really have a lot to do in terms of educating patients on their oral health needs in this chronic illness population. So for diabetics, just to take one of them, they're at increased risk for gum disease, tooth loss, dry mouth, thrush. The high blood sugar can help their bacteria grow, leading to tooth decay and interfere with healing. So we want nurses to be sure, look in the mouth, examine them, screen for cancer, and then monitor the glycemic control, educate the diabetics or any of the chronic illness patients on daily toothbrushing and flossing, diet, exercise, weight control, smoking, strategies for dry mouth, and then be sure they have a dentist to go to. So nurses are the ones who are really doing a lot of the chronic care and management of these patients, so they really need to be sure oral health is part of it. Then we worked with the University of Vermont and Duke to develop these avatar and a video, because the University of Vermont does not have a very diverse population, and they want their students to have more diversity. So the avatar was an Asian, a Korean woman, and with diabetes, and then we worked the oral health into that. And then this woman we videoed down in Duke, and she was a Hispanic woman who had a lot of health problems that we also integrated oral health. So then their students have a virtual clinic where they can go in and meet these patients and take care of all their oral health needs as well as their other health needs. This is a big event we run every year. We've had it for 7 years now. We just sent out a video this morning on how to do it, and we call it TOSH, Teaching Oral Systemic Health. This year we had 800 students in it. We run it over 3 days, and we get a standardized patient, and the standardized patient has symptoms of type 2 diabetes, periodontal disease, and acute tooth pain. And we have a team of students, a nurse practitioner or midwife, a dental student, a medical student, and a pharmacy student. And they have to work together as a team, take a health history on the patient, figure out what the problem is. The dental student does the oral exam, teaches the other students the exam, and then each of the students have to do a return demonstration. Then they all go into a debriefing room, briefing room, and do case study discussion and figure out a plan that all of them can agree on and collaborate and communicate. And then they practice calling each other as if they weren't there and telling each other about the patient, and practice just different communication techniques from team steps. So with this program, we also have done a study. This is the ICAS survey that I mentioned to you before, where students take it before and after their interprofessional experiences. So it's communication, collaboration, roles and responsibilities, family-centered approach, conflict management, and team functioning. And they grade themselves before the experience, and then they do it again after to see if there's been any change. So as with the pediatric approach group, with this simulation, we saw the same thing, that they reported an increase in their interprofessional behaviors from before to after. And it was pretty similar across all 3 schools. And now we have a 4th school involved. We do pharmacy too, and we're showing the same exact thing. So we feel like just a simple little event like that, which is a 2-hour event, really can increase the ways students can learn to work together and learn oral health. So we have written an article on the first 3 years of it, and we have to get the next one up on the last 4. Also for adult health, we have a simulation on Parkinson's disease and Lewy body dementia, because these patients really have a hard time with maintaining their oral health. So we have the nursing students and the dental students come in and meet a standardized patient with this problem, and then they have to figure out a plan. We have our nurse practitioner students go to Gouverneur, which is a big place where we have a lot of clinics, and they go with the medical residents, and the dental faculty is also involved in making sure that oral health they have a week where they work together and being sure they're integrating oral health. And I was working on this mucositis team, and this is
11 people watching now.
This is for the NYU Medical Center, and we have a team we all got together.
Whoever's joined Zoom, could you mute yourself, please?
Juliet,
Hi, yes, hello.
Hi, Juliet. Do you mind muting?
Oh, muting, sorry.
That's okay, thank you. So our mucositis team is really a great interprofessional team. We had infectious disease, dentistry, adult med, oncology and peds oncology, pharmacy, pain, the inpatient, the outpatient, the GI. So we developed this whole protocol so that everybody is on the same mucositis protocol. So that was really, really something we needed to do for oral health. And then this is the article we wrote about integrating oral health throughout cancer care. And then acute care, We have a lot of problems with our pneumonia in the hospital, and people who are on vents, people who are not on vents getting pneumonia, increasing morbidity, mortality, length of stay, and cost. And we find that oral health can really make a difference because a lot of the dental plaque is giving them the microhabitat. Germs in the mouth can replicate 5 times in 24 hours. They're often aspirated, especially in people who are ill because they have a weak cough and a poor immune system and lots of comorbidities. So oral health inpatient is really, really important, and it's often so neglected. But we do have a big program at NYU where people are trying to get they're stratified according to risk when they come in, as far as what their oral health needs are, and then they're on an oral health protocol depending on what risk they are, whether they need it every 2 hours, 4 hours, 6 hours. They get oral health education, oral health hygiene, I'm sorry. And then we have this program where it was written up in the Wall Street Journal that every patient who comes in for surgery has to brush their teeth before they go to surgery. So the nurse who's admitting the patient gives them a toothbrush and insists that they brush their teeth to decrease the bacterial load before they go to surgery. And this is one of the nurses that we work with. She's developed a wonderful oral health program for all the Veterans Administration hospitals. And I think she's gotten this program now into 35 different VA hospitals where the patients are, again, stratified according to risk and how much oral care they need. And she's really doing great with this protocol. Next is our behavioral health, where we just find that this is often a serious problem for people who have mental health problems and their oral health is neglected. They may be neglecting it because of their depression, or maybe because they're abusing drugs or alcohol or tobacco. They may have a bipolar disorder, an eating disorder that can really affect their oral health, or they may be on some of these antipsychotic or antidepressants cause a lot of xerostomia, so they have a much higher risk for bacterial infections. So nurses in this area, we want them to still make sure, even though they're doing mental health, to look in their mouth, to educate patients on caring for their mouth, on nutrition and hygiene. Many of these patients may be suffering from dental anxiety, or they may need some management with their medications in terms of xerostomia. There may be medicines that might be better or work just as effectively with less side effects. This is one of the programs we did a preceptor. We invited all our preceptors in because we felt like we were sending our students out and our preceptors didn't really know much about oral health. So we did an oral health throughout the lifespan, and we had each nurse practitioner, the director of each program, give a short presentation on the importance of oral health for each of that. And then we had standardized patients, and all of our preceptors learned about oral health. But our mental health nurse practitioner director, she gave it on dental anxiety so that it was something that all of them could really learn from. And it was really very, very well received, because patients across the lifespan have dental anxiety. And then when we get to the older population, many of them still have their teeth. These are teeth that may have lots of restorations, and now they need a lot more help as they get older, and often they find they don't have any dental insurance, and so they're really, in need of oral health because they still want to eat and kiss and smile and have a good quality of life. And so they really need to be sure they can get to a dental care, even though they have a lot of barriers between whether they can afford it, whether they believe they should be going, and if they have any transportation issues. So we want our nurses working with the older people to be sure they're screening them for oropharyngeal cancer, educating them on toothbrushing, flossing, diet, weight control, and make sure you can connect them with a dentist and let them know what the importance is. We have one program where we go out into the senior centers with the nursing students and the dental students, and we do an education program for the seniors, for the volunteers and the home health aides and the case managers on oral health for seniors. And then we have, this is a good webinar series that's on our website for oral health in older adults. There's an overview, there's one on dementia, acute care, and then long-term care. And it's still up there on our website, even though we did it a few years ago, it's still good. These are oral care cards that one of our nurses developed for ways to deal with patients when they have dementia and they are exhibiting care-resistant behavior, not wanting anyone to brush their teeth or help them with oral hygiene. And these are, she goes around to the nursing homes and teaches the nursing assistants how to approach people so that the oral health will be more acceptable and they won't be frightened of it. And then at the end of life, again, it's something that's often forgotten, but people, when they are coming to their end of life, they still have dignity and they need nutrition and comfort and communication and intimacy, and they want to talk, laugh, smile, and they want their mouth to be clean. So we have just a preventative oral care for palliative care patients, and we have our palliative care nurse practitioner director is very, very good at this and getting this education brought to her students and to different conferences she goes to be sure it's not something that's left out. So I had mentioned that we looked at the midwifery program as far as how many programs are integrating oral health. We also did a national survey of the nurse practitioner programs. So the midwives were the best with 85% and 33 out of 39, but pediatrics wasn't so bad, 68% are integrating oral health. The family nurse practitioners, 41%, and the adult GERI, 56%. So we wrote an article about the midwifery and the nurse practitioner. So it is something we see. We still have a lot more work to do to get more people, but we're very proud of our midwives. And we're very proud of our students because they started their own interprofessional student group. They get together on their own. They have 10 different professions that they just decided to do it. And they have the nursing and the medicine and the dentistry, but then they have social work and OT and PT and speech. And they get together maybe once a month in the evening and they either have a collaborative case conference and they make it like a game where they have a patient and they make these interprofessional teams, and then who's ever got like the best collaborative care for the patient, they have a panel that judges them, and then they do some social service. They had a Christmas party, they called it a sock hop, and everybody had to bring socks for the homeless, and they ran a health fair. So they're really like doing all this on their own, and myself and my colleague are the faculty advisors, but honestly, we don't have to do anything. They do it all on their own, and they've really done a great job. And their attitude is, well, why wouldn't we have an interprofessional group? Like, it just seems normal to them. So even though I feel like we have come a long way, we certainly have had a lot of challenges obtaining buy-in. Not all schools were really excited about oral health, and a lot of people weren't that excited about interprofessional education, but I think over the years, people are really enjoying it and learning that it's been very, very good for them. Scheduling is always a problem, and that's why maybe more virtual things might be good. Often we had to fight some scope of practice myths where people were saying, well, why would nurses be doing oral health? So it is in the scope of practice of a nurse to take care of someone's mouth. It is part of their body. And then we get a grant, and then maybe the grant's gone the next year. So we have to be sure that we keep getting more sustainable resources. And then we find that our electronic health records often don't communicate. So that's an issue that needs work. And evaluating the programs is something we want to keep working on. This is our website. We welcome anybody to come and use any of our resources. It's open access, everything's free. And be happy for anybody to use it. Smiles for Life is a free online oral health curriculum, which you can have either download modules to use for teaching or have your students go and do the online modules and then give a certificate to you. And it's in 8 different modules across the lifespan. There's also, you can download the Smiles for Life mobile health app and have everything right at the bedside. This is on our National League for Nursing. We developed some teaching strategies that you can use for oral health in seniors. And then we did the same thing in pediatrics, again, for the National League of Nursing. And this is a little simulation with 3 different scenarios where a little girl goes to primary care to get her immunizations. They find she has all these early childhood caries, so it's a lot of education for the students. And the next scenario, she's in the PACU because she had to go to the OR to get her teeth fixed. And then the next scenario, she falls in the playground and now she's in the ER with a tooth avulsion. So there's lots of good scenarios. You could pick and choose whatever you like. And then part of it is the students have to finish the story. Like now, you know, she's 6 years old and what happens. And it's also, there's nutrition and an obesity module in there as well. This is our signature article. It's called Putting the Mouth Back in the Head, HEENT to ENOT, because we want our students to not forget the oral cavity, to not to just do the head, eyes, ears, nose, and throat exam, but to include the mouth. And these are some patient oral health facts also on our website you can download. They're in English and Spanish, and you can use them with any of your patients. These are our networking. So we have a Facebook page, and we have a Twitter, and we have a blog, and we have some YouTube stuff out there too. So right now we do have at least 1 nurse program, an oral health initiative in each of the 50 states. So we're still working on getting more. And we feel that we are just trying to increase our oral workforce capacity, and that by knowledge and learning to trust and respect each other, we can all collaborate together for better health for our patients and to decrease oral health disparities. So I thank you. I'm sorry I ran right till the last second here. Any questions?
Yeah. Why don't you sit down? You're freaking standing for a while. Thank you, Erin, for that presentation. I think, as you can see, there's a lot being done in NYU. We've been slow to the party, but we're getting there, slow and steady. But Erin, many of you may not know, but we've kind of adopted her. She's an adjunct at Western Sydney University, and we're going to be working with her to try and tailor some of our programs using the framework that I've developed. Primarily, we're going to start as looking at the nursing curriculum and using some of the resources. And we have a student who's going to be exploring that next year. But yeah, Erin's daughter lives in Bondi. So we might be seeing her more often. But it's really good. And really excited to have this collaboration and work towards making oral health nursing actually a term that people don't get surprised about in Australia. So thank you again, Erin.
Thank you.
Any questions? I know it's almost time, but any questions from Zoom or in the room?
Jesh, it's Virginia here.
Virginia.
Look, it's just an absolute delight to listen to that, to see the synergies with your work, Jesh. And really, for me, lovely to hear midwifery mentioned about 1,000 times in the presentation, only because, not because of anything special, but because it's come from the States, and that's a lesson. Of course, that's where Ajesh's work actually started, really kicked off here as well. But look, I was absolutely fascinated by the depth of the interprofessional education, and I'm really pleased to hear, this is more a comment, it would be, I nearly, by the time I'd just run upstairs, because I've just thinking about some work we're doing in perinatal mental health around the interprofessional education, just fascinated by some of the techniques that you've got there. And wow, what an initiative to have those students doing that work. So I think our Dean and everyone would actually love to hear more about that, because we need to move in this space. So I have no idea how long you're here in Sydney this visit. Jess, you might be able to.
I have to leave tomorrow.
She's leaving tomorrow,
Right.
but we can always Zoom and
Yeah, no, I'm just thinking as we build, you know, people are starting to look at this in the simulation as we build that. Erin, I think we you know, it'd be wonderful to have you as a sort of, you know, an adjunct, but a mentor around that, or to brainstorm some of the ideas and have a look at some of the resources. So it'd be very exciting. Thanks.
Oh, thank you. Yes, anytime.
Virginia's the director of research for our school.
Oh, okay.
And a midwife.
Yeah. Oh, that's great. Yes, you could just, you know, email me, and anytime we can get together.
Yeah, no, that'd be fantastic. Thank you.
Yeah, and just like, so Erin came down to Melbourne because we I think I mentioned at the professoriate meeting, we had a national launch of the integration of network for integration of oral health. So Erin's going to be continuing to work via Zoom with a lot of people in the interprofessional space.
Yeah. I'm not sure whether Tracy's up there with you, Ajesh, at all. I can never see, but, or online, but I think Tracy, in relation to simulation, that'd be really interesting as well.
Sure. Sorry.
Thank you. It was a wonderful presentation. I have an interest in terms of the longitudinal results of interprofessional learning. So when students graduate, become health professionals, work within the world that is probably not as flexible as perhaps some learning environments, have you got any data on whether they view collaboration, that view of collaboration continues, or if it is impacted upon by structural constraints?
Yeah, we really haven't studied that, although it is definitely something we want to do and try to follow our students and see. We do hear from the ones who are doing it, will hear, or they'll ask us for certain collaborations. But one thing we have in our pediatric dental clinic right now, the attending dental attending was one of the initial dental students in the interprofessional collaboration, and now she's actually practicing and supervising it. So it is coming around. We're seeing it enough years that we are seeing it, but it would be great if we could really track the students, but you kind of lose them after they graduate. So that's the problem.
That's very interesting. Thank you for that talk. It's really interesting, fascinating what you've done, such a huge one aspect that you could take into so many areas and do so much. And just this morning, Ajesh and I were talking about interprofessional learning and communication and teamwork and collaboration. That's all of my areas. So
Good.
I think it's really good that you can see how it fits within every aspect of nursing as well. It's, you know, across disciplines, which, like Virginia said, we definitely need to move more into that space. Yeah. But this, like oral health, is like I would never have thought to fit it into mental health care, for instance.
I know, right? It's
that
really
was
so important. Yeah, neglected area. People don't think that because we didn't really learn it when we went to school.
No, we did the glycerin mouth swabs. That was about it. Remember those horrid? Oh, they were disgusting. Used to rub them around the patient's mouth. Oh, there's oral care done. You know.
I guess the other thing that was really interesting about what you've done is that you haven't put people in traditional roles. So where you actually get them to exchange in terms of what they contributed to that patient exam was, I think, really important, because what you are not doing is is saying you're the doctor, so you only do the diagnosis, you're the nurse, you only do this bit. You actually alternated across to show that, as you quite rightly say, there is no limit to scope here, and that is more about territory rather than actual scope of practice. Yes. And I think that's one of your biggest, I think that, I mean, I love the whole thing, but if I was looking at a super strength, I think that's your super strength, is because every health professional is treated equal. And that's very rare when you get scenarios. Even when we do simulation, if you look at some of the interprofessional simulations, the doctor does the diagnosis, the nurse, you know, so it's almost perpetuating the myth.
Right.
So
yeah,
that's
so we're really trying to get interprofessional and team collaboration.
Can I ask how long it's taken you to develop this program?
So we got the OHNEP grant in 2011.
Okay.
So it's been a while. I came in 2013, right after I developed the pediatric oncology program. So that was my doctoral work. So then they got the grant to come and do this. So it's been good. It's been good, but it's, you know, it's certainly taken a while. It's not overnight, and to get people who are interested in it, and then once they do it, they like it. But you know, to get people on the right schedule and get it's challenging.
All right, so there's no questions. Any other questions via Zoom? No. All right, well, thank you all for coming, and thank you very much.
Thank you.